Hey guys, it's Dr. Alicia here from She Found Health. Welcome. Today we are going to talk about vaginal exams during pregnancy and vaginal exams during labor. We'll talk about some of the reasons why we might do them. We'll also talk about what are we looking for when we're doing a vaginal exam or cervical check. And we'll talk about some tips and tricks for you if they're uncomfortable for you to help make them a little bit more comfortable. We get it. Vaginal exams in pregnancy are not everybody's favorite, and they can be uncomfortable. So hopefully we'll review a couple of tips and tricks for you at the end to make them more comfortable. Now, take a moment and just read our quick medical disclaimer in the show notes below. Also, we'd love it if you would join us for our Best Birth Training video series. We also have a great download that accompanies it. It's about our 5 top tricks on how to prepare for your best birth. So if you're pregnant or if you're coming close to delivery, please check that out. Also linked in the show notes below. So let's get started. First things first, vaginal checks during pregnancy. Why might we do them, you ask? Well, we have a few reasons, and there's many more reasons, but these are kind of the more common reasons. Number one, if you are cramping, if we're wondering whether or not you're going into preterm labor, we'll want to check your cervix. Now, there's a little caveat to that. There's a test that we can do up until about 34 weeks that we need to do after you've had nothing in your vagina for 24 hours. So if you're kind of 28 or 32 weeks, oftentimes we won't check your cervix, we won't do a vaginal exam until after we've performed this test, which is a speculum exam with a couple of tests. And we'll tell you a little bit about that to determine the risk of you going into preterm labor. Another reason we might do a vaginal exam during pregnancy is if we're worried about baby's position. So if we're not entirely clear if baby's head down or bum down, sometimes we can tell on a vaginal check. So on a cervical exam, we can put our finger through the cervix to feel if there's a head there. Generally speaking, we don't do this until about 36 or 37 weeks of gestation, but that is certainly another reason that we might check your cervix through a vaginal exam. Another reason that we might do a vaginal exam is early on in pregnancy if you're due for a pap test, or if we want to make sure that your uterus is the appropriate size for your gestational age. So oftentimes we'll do a vaginal exam early in pregnancy. Not all the time. Sometimes if you've had one recently, we don't need to, but sometimes we will need to do that. And then the other reason during pregnancy is as you're coming to the end of pregnancy, oftentimes women are curious as to what their cervix is doing. And we'll talk a little bit more about what the cervix does during labor in a second, but we'll offer cervical checks through a vaginal exam at around 38 weeks onward, and sometimes we'll often offer cervical sweeps at the same time. So that's kind of talked about vaginal exams during pregnancy. So let's talk about vaginal exams during labor and when we might do them. So how we see how labor is progressing is through the change in your cervix. Your cervix is the area between your uterus and your vagina. And over the course of labor, your cervix starts off quite firm and long in most cases during pregnancy. And nearing the end of pregnancy, it can start to soften, it can start to open up a little bit, start to thin out a little bit. And then during labor, it continues to do that until it's thin, 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 and very dilated so your baby can fit through it. We call that 10 centimeters dilated. So how we know that labor is progressing normally is by if your cervix is changing. So early labor, it thins out and it starts to open, and then active labor, so about 3 to 4 centimeters until fully dilated, or 10 centimeters. It continues that thinning process until it's paper thin and then dilates to about 10 or more centimeters so your baby can fit through it. So the reasons that we would check you during labor are: one, what stage of labor are you in? Are you in that early phase that can sometimes last a few days and you're 1 to 2 centimeters dilated and still a little bit of thickness? Or have you progressed and you're now in the active phase, so 5 or 6 centimeters dilated? At that point, we can have a better sense of what normal labor would progress like, about 1 centimeter an hour in somebody who's not had a baby before. So we like to monitor the progress of labor through cervical checks. Now, we don't do them very often. Every 4 hours usually is enough. Sometimes we have to do them a little bit more frequently if baby is a baby's heart rate is a little bit different than we would expect, or if the progress is much slower than we would expect, we might, after making some changes in management, check you a little bit more frequently. But generally speaking, about every 4 hours. Another reason in labor that we would examine your cervix through a vaginal exam is for pain management options. So depending on how far along in labor you are, depends on what pain management options we can offer you. So if you are at the point that you need something more than sitting on a birthing ball or getting in a warm shower or tub or using some pressure on your back, if you're needing medication for pain management, we need to know how far along you are in labor to help you decide what pain management options there are. And so that definitely changes depending on how dilated your cervix is or not. Another reason that we might check you in labor is if your baby's heart rate begins to go too fast or too slow. We need to know how close or not close you are to delivery, or if there's any other concerning features along with that. Another thing we can do via a vaginal exam is tickle the top of your baby's head. So if we're worried about your baby's heart rate, often we'll tickle their head. It's called scalp stimulation. And if they have a nice quickening of their heart rate as a result of that, we know that they're physiologically doing quite well. So that's one of the things that we might do if we're worried about your baby's heart rate. So we've kind of talked about the reasons, and again, there's many more reasons, I'm sure, but those are kind of the main reasons why we might check your cervix during pregnancy or labor. And one more reason I realized is if we are planning on doing an induction of labor. So if for some reason we need to help your labor along, we need to know some of the things about your cervix to make a decision on what method of induction of a labor, because it depends on how quote unquote ripe your cervix is. So that would be another reason in pregnancy we would check your cervix as well. So those are the main reasons we would check your cervix through a vaginal exam. But what are we talking about? What are we looking for when we do that cervical check? Well, there's a few things that we're looking for. So the first is how thick your cervix is. So the reason is our cervix needs to thin out before it can really start to dilate. So I've got these elastic bands to try to help show you what that looks like. So these are just regular hair ties, normal elastic bands, nothing fancy. But you can see when I have a thick cervix, it doesn't stretch very well. So we need our cervix to thin out before it stretches out well. So let's say I take away half of those elastic bands, or half of that cervix. So now we've gone from a 3 centimeter long cervix to a centimeter or so. Look how much more stretch there is. So if we thin that cervix out even more, so now we're going down to about half a centimeter cervix, even more stretch. And if we get it thin, 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 we got lots more stretch. So lots more stretch. So we need to thin our cervix down. So that's what we call effacement. The thinning of the cervix, or how effaced the cervix is. It starts off usually at about 4 centimeters long, about 50% effaced, so halfway thinned out would be about 2 centimeters, and fully effaced would be paper thin. So that's the first thing we look for. The next thing we look for is dilatation. So usually our cervix, when we're not pregnant, or hopefully during most of our pregnancy, it's closed. We can't put a finger in. As we start to prepare for delivery, so we're getting closer to our due date, sometimes our cervix will start to thin, but it'll also start to dilate out a bit. And so I've pulled some things from around the house. This is from the top of my lipstick or lip balm. 1 centimeter dilated is when I can fit 1 finger in. So my finger is about 1 centimeter in width, so I can fit 1 centimeter in. So when you're 1 centimeter dilated, or fingertip we also call it, it means that we can fit 1 fingertip in there. This top of a moisturizer bottle is about 3 centimeters, so 2 to 3 centimeters. So I can easily fit about 2 centimeters in there. So that's about a 2 centimeter dilated cervix. This top of a thin mason jar, this is about a 5 centimeter dilated cervix, or 5 or 6 centimeter dilated cervix. So when we say it's about 5 or 6 centimeters dilated, we're talking about that. This wider mouth mason jar, that's about 9 centimeters dilated. So that's almost fully dilated, but not quite. And when we talk about being fully dilated, what we actually mean is you cannot feel cervix anywhere around the head. So we say 10 centimeters, but truly it's just that you cannot feel cervix anywhere around baby's head when baby is in the birth canal. So that's kind of talking about dilatation. So we've talked about effacement, so how thin or thick your cervix is, and dilatation is how dilated. So fingertip all the way to fully dilated, or 10 centimeters, so baby can come through. We can't start pushing, especially with our first baby, until we're fully dilated and there's no cervix around the edge. So the third thing we talk about is baby's position. So how far in or out is baby when we check? So how high up is the head, or how low down close to the opening is it? And we use something called the ischial spine. So these are little bony prominences on the bottom of your pelvis that kind of a lot of your perineal muscles attach to form your pelvic floor. So there's these two bony prominences, and they sit on either side of your vagina, and so we can feel when we do a cervical check. So if I was checking your cervix, I'd have a couple of fingers in, and we can feel those bony prominences. So that's what we call spines. So the ischial spines. So if baby is high up in your pelvis, so hasn't dropped, there are often spines minus, so away from the outlet, spines minus 1 or 2 or 3 centimeters. If baby's head is nice and low, you've been pushing for a while, or you've been fully dilated and baby's head's come down, they're towards the outlet, they're plus. So plus 1 centimeter, plus 2 centimeters, plus 3 centimeters. So that's the other thing, is how high up or how low down is baby during that check. So those are the big things that we're looking for. So we've talked about the reasons why we do cervical checks, both in pregnancy and in labor and delivery and induction of labor. And we've talked about the major things that we're looking for. We also look for baby's position. So we try to feel if they're, which way their head is facing, because that can make it easier or harder for them to come out. And then the last thing I want to talk about is some tips and tricks if you do find vaginal exams challenging, which is very common, especially in pregnancy. Even women who had never had problems with speculum exams or intercourse or vaginal exams outside of pregnancy, things are much more sensitive during pregnancy, and often it's more uncomfortable than it's ever been in their life. So there's a few things that you can try to do, which is easier said than done sometimes, to help make those exams a bit more comfortable. So the first is relaxation, which is really hard when somebody is doing a vaginal exam. But taking a bit of time, doing some deep breathing, really letting your bottom sink into the bed that you're lying on. Some people close their eyes and do a bit of visualization, and sometimes that can help. Just allowing your perineal floor to relax as much as possible can really help with the discomfort of having a vaginal exam. The more anxious you are and the more tightly squeezed those muscles are, the smaller the area for us to examine and the more uncomfortable it can be. So really trying to relax with whatever way works for you. So some people do some relaxation techniques before. I've seen some people do some using their hypnobirthing or their relaxation earbuds, kind of doing that, or just deep breathing and really feeling like you're sinking into the bed. So that's certainly one tip that can be quite helpful for women. Another tip that can be helpful, especially if we're in the hospital, is using some nitrous oxide. So that's the laughing gas. And so some women find that very helpful to just help them relax during those vaginal exams and cervical checks. So that's a medication that is an inhalational anesthetic. So we breathe it in, and it's very quick onset. So a couple of breaths and it's in your system, and it's very quick offset. So after you stop breathing, it's out of your system pretty quickly, but it works reasonably well to help you relax and help some of that pain management for a short period of time. So often in transition, so women are 7 or 8 or 9 centimeters dilated, they'll use it during their contractions for pain management. But a great use of it in the hospital is during vaginal exams. If they're very uncomfortable for you, you can certainly ask to use it if you have nitrous oxide availability. So those are kind of the tips and tricks to helping make those vaginal exams a little bit less uncomfortable. So there you have it, tips and tricks for vaginal exams. Again, thank you so much for listening and watching today. If you find this useful, we do lots of videos on prenatal, labor, delivery, postpartum, and newborn care. So make sure to subscribe below and click that bell for notification to get notified every time we release new content. You can also sign up for our email newsletter at www.shefoundhealth.ca, and we'll link it below. And make sure to check out our Best Birth Guide and webinar series, our 5 top tricks on how to prepare to have your best birth. Have a great day, guys.